There's two ways to test for allergies. The most reliable, the least expensive, and the most painless way is skin testing. We use a tray of allergens that includes both indoor and outdoor allergens. We will usually place about anywhere from 20 to 70 tests, and that involves just slightly pressing, usually it's a plastic device on the arm or the back, and with a small amount of allergen liquid on the tip. And if you have allergies to the specific allergen, then the area that was tested will start to itch and turn red and swell. So in order to have skin testing, you should not take an antihistamine for at least 3 to 7 days prior to the skin test. Blood testing is another alternative for patients who may not be able to stop taking antihistamines, or patients who may have a skin condition that causes skin tests to be unable to read. With a blood test, we're actually looking for an IgE antibody, which is the antibody that causes an allergic reaction. And if you test positive, then we can recommend allergy shots. They're the oldest, most time-tested way to treat allergies, and insurance companies pretty much universally will cover them. The medical term for allergy shots is immunotherapy, because the shots actually alter the immune system so that you won't react to the allergen like you used to do. Allergy shots contain the actual allergen to which you are allergic. We have very small quantities of allergen in the shots initially, and then we build up to a stronger dose, also known as the maintenance or effective dose of allergen. The other substances that are contained in the shot is simply salt water and preservative. So there's no drug or medication in the shots at all. It's kind of a natural way to cure your allergies. Allergy shots are given in the arm. They're actually just given into the skin. They don't actually go as far as the muscle. So you would not have the soreness and pain that you get from a typical vaccination like with a flu shot. So once a patient starts allergy shots, they're in what we call the build-up phase. And during the build-up phase, they receive shots once a week for 2 to 6 months, depending on the schedule that the patient chooses. After that, then they reach the maintenance phase, in which they receive shots every 2 to 4 weeks for a total of 3 to 5 years, and then we stop. And most patients will have continued improvement, perhaps lifelong improvement, or complete elimination of their allergy symptoms. The most common side effect from allergy shots is some swelling, itching, some redness at the site of the shot, which may persist for a day or two. Anaphylactic reactions to allergy shots are rare, but they do occur. An anaphylactic reaction is an allergic reaction that's severe or life-threatening, or involves 2 or more organ systems. That's why after a patient receives a shot, it's recommended that they wait for 30 minutes in the doctor's office. In most cases, they're successfully treated with epinephrine. The only way to permanently treat your allergies is to take allergy shots. So while medications can treat your symptoms, allergy shots can prevent the symptoms.